thank you very much, Senator Dodd, and thank you for hosting this forum and inviting me to be a part of it. This is a great crowd, and the Senators already thanked you for coming out on what I'm sure is a pretty busy weekend to join us here, and we appreciate your turnout. I really want to get to the experts here and then turn this over to you, so I don't have much more to add beyond what the Senator has added, except to express, I think, the same sense of hopefulness about the course that lies ahead of us in Washington. I worked on healthcare policy for the 8 years that I served in the state legislature. I served 4 years as the chairman of the health committee. And while I still remain incredibly optimistic about Connecticut's chances to pass state reform and 49 other states that are working to try to make better state healthcare policy, I ran for Congress in part 2 years ago, now 3 years ago, because I saw the solution ultimately had to be a national solution. And then I thought with the right players in place after the 2008 election, we might be at a point where we could tackle this problem. I think the Senator's right. In this crisis, there does come a real opportunity. For middle-class families out there, the people that make up the communities of Connecticut and the 5th District, they knew that the economy was in crisis long before the financial companies did. They've been struggling with paying for college for their kids, with getting gas in their car, and paying for health care for a very long time. Families out there knew that our health care crisis was not just one of moral consequences for the 40-some-odd million who don't have health care insurance. It was an economic crisis for individuals and families that just simply couldn't foot the bill anymore. And the genius of health care reform, at least if we do it right over the course of the next year, is that it not only extends out health care to those people that don't have it. It not only brings us out of the dark ages and puts us with all the rest of the countries of the industrialized world, which sees healthcare more as a human right rather than a privilege available to those people that can afford it. It also saves us money. It saves us money as a government, it saves us money as an economy, and it starts to remove some of the competitive disadvantages that we have with respect to the rest of the world. The Senator highlighted prevention. I'm somewhat agnostic as to what that ultimate system of universal health care coverage is, but I know that there's one word at the center of it, and it's that one word, prevention. I'll just mention one story from my days in the state legislature. We were doing a hearing before the health committee that I chaired on some of the Medicaid cuts that we were talking about imposing at the state level. And we heard from one woman who came to us on crutches. And she explained to us her story from about a year earlier from that hearing. She had been working, but at a job that didn't have health care benefits. She was making close to minimum wage. She couldn't afford insurance on her own. She just made enough to keep the lights on and herself and her family fed. And she started experiencing pains in her foot, pretty sharp pains, but one that she thought that she could bear. And so she didn't go to the doctor because she knew that that would not only cost the visit, the expense of the visit, but also she'd probably get prescribed some drugs that just weren't in her budget. And so she let that pain persist, and it went on and went on and went on until one night she just couldn't bear it, and she went to the hospital. Well, when she went to the hospital, she had an infection that was so bad that the doctors had no other option except to amputate that foot. The rest of her life changed simply because she didn't have access to health care. And a procedure in the end that cost $50,000 or $100,000 that could have cost pennies on the dollar if she'd just gotten the antibiotics that she needed. That story, although grave, can be retold at various levels of seriousness millions of times around this country. People's lives having to be changed, expense added to the system that just doesn't have to happen. As we fight this battle down in Washington, led by Senator Dodd in the Senate, when this health care reform bill that we hope comes before the Congress, comes to the Senate, it will be Chris Dodd that's going to be leading the charge. And I think that should all make us feel very strong, very warm as residents of this state. He's going to do it with your stories, and I hope to do it with your stories as well. So I thank Senator Dodd for coming here and allowing a forum for us to really take your stories and bring them back with us to try to fight this reform for health care in the United States Congress. Thank you very much for coming out.